most people don't know that between 12,000 and 15,000 people right now in Shelby County are going without any mental health care. They do not seek services, don't know where to go. And this is 12 to 15,000 or more people on the street.
Right.
Okay? That is a huge problem. And the African-American community, as a whole, does not understand how emotional and mental health affects how we live every day. For instance, if you look on the front page of the Commercial Appeal this morning, there's a story about a Mr. Cooperwood who was there when the officer was hit on his motorcycle. Well, he's a recovering drug addict. And this is just an example. And he received care from a program that he goes to every week, and he's turned his life around because he's received help for his mental health problems, which was drug abuse.
Okay.
And this has turned his life around, and when that officer needed him, he knew what to do. He was there. I mean, this guy he was a petty thief, in jail, all those kind of things, which says, I have emotional and mental health problems. The African-American community don't understand, James, and the biggest thing we have to overcome is that there's a stigma. We don't want to talk about mental health.
Right.
But the black community needs therapy. Believe me, we need therapy in all parts of our life, whether it's in the church, whether it's in our home, our families, in our educational system, in our communities. If you just look at it and think about it, we need therapy and counseling more so than most people.
Absolutely. And I'm looking at that article that you mentioned just a moment ago, the front cover of the Commercial Appeal, when Lieutenant Governor Gregory Quinn was slammed from behind by a hit-and-run driver as he rolled up to a red light on his police motorcycle. Michael Cooperwood ran to assist. Back when he was committing crimes and doing crack, Cooperwood says he probably wouldn't rifle through, he probably would have, rather, rifled through the officer's pockets. So, rather than being a part of the problem, Mr. Cooperwood apparently has become a part of the solution.
And one of the problems that we have as an African-American community is that only 2% of psychiatrists are African-American.
2%?
2% of psychiatrists are African-American, 2% of psychologists are African-American, 4% of social workers in the United States are African-American. What that means is that we basically don't trust the system, because when we seek treatment, the majority of the time, we're going to see people other than us. And that's why this thing called culturally competent treatment is so necessary. When we walk in the door for treatment, we just don't want to talk to anybody, okay? Right. There's certain people that we will open up to, and one group of those individuals happen to be our pastors. And I have worked in state government to get money to do a program that puts together the church community, the education community, and the healthcare community at churches where people can go to their church and receive counseling and therapy at a place where most African Americans feel very comfortable. For instance, when they had the day where you could go and get your background cleared from things you missed in court, and they did it over at New Salem, the place was packed.
I can imagine. Yes.
It was packed. I mean, New Salem and that pastor over there did one heck of a job in getting people to come forward and say, I want to clear my name and clear my record. One of the best turnouts in the country. Well, believe me, this program will bring people in to get the kind of services that we need. Did you know that 25% of our children in school are bipolar?
No, I didn't know that.
But they are not treated for it because parents can't recognize it. A lot of the time the teachers can't recognize it, and they have this behavior, and it goes through, individual goes through school with this kind of emotional problem that can be fixed, but we never recognize it and never get treatment for it.
No, I didn't know it was that pervasive among our students. This, excuse me, this whole idea of mental health goes back for me to federal budget cuts, in the sense that at one time there were provisions for taking care of, our mentally ill folk or citizens. It seems that when we started cutting back, children and things like mental health, just they were the first to go.
Well, that's true, but you got to look at something even deeper than that. You know, African Americans have never been a community of people who sought out mental health and therapy and counseling. And with our background, coming from slavery, coming through the labor situation and so forth, the wheels are coming off of our machine. Okay? Our background should have had us in therapy and counseling, 50 or more years ago. We have never received it. Our therapy has been the fact that we used to work so hard. You remember, our parents, and you and I are basically the same age. I might have a year or two on you.
Yeah, well, under me, probably.
But, my dad worked 2 and 3 jobs.
Right.
And that was his therapy.
Right.
Okay? We could always go out and find jobs. And if you remember, we didn't have a lot of crime or anything until Friday and Saturday. Exactly. Now crime is a real big 7-day-a-week job. Anything can happen. But back when we were coming along, our crimes were basically limited, a whole lot to the weekend.
That's something I've never given any thought to, but when I do, you're absolutely right. Crime was a weekend issue.
That's right. But now, now that we've closed down the Firestones, we've closed down the roofing companies, we've closed down all the industries that was our therapy, real problems are beginning to show themselves because the jobs are not there to keep us busy, to keep us doing something from facing some of the harsh things that have happened to us.
Now, coming up during the next hour, I've got a couple of guests from the West Tennessee Health Diversity Institute, and we've been doing this for the last several Saturdays. And as a result, I've learned some of the things that you're speaking on today are some of the issues that they will be addressing, especially the mental health issue. And I actually talked with a black psychologist a couple of weeks ago who's going to be a part of that. So this is not to jump into the next hour, but apparently this is a big issue that we really need to pay a lot more attention to than we've done in the past. We don't have that much awareness about the depth of the mental health problem. Why not?
Well, because, like I said, it's a stigma that we have to overcome. That's why I went to Nashville. I asked for $1.5 million for a pilot project. But, of course, in Nashville, you have to get pretty much what you can, you got to take what you can get. And now we have enough money to do a 6-month pilot project. I'm going to have to go back with the information that comes from this project and get more dollars. But we have to put this on the radio like you're doing today, and I commend you and the radio station for this topic. We have to put it in our churches. Part of my program would train pastors to be community navigators so they can steer people to the proper kinds of treatment that they're going to need. This has to become a part of our daily dialogue. Let me give you another statistic that really jumps out at me. Over the last 15 years,